For patients who relapse early after one of those chemoimmunotherapy regimens, bendamustine, rituximab, or R-CHOP being the most commonly used ones in the United States at present, those are patients that have very poor expected overall survival and progression-free survival. In a landmark paper that was led by Carla Casulo from the National Lymphocare Study, we saw that patients who have R-CHOP as their frontline regimen and then relapse within 2 years of their primary therapy have very poor expected overall survival of approximately 50% or less at 5 years. So for those particular patients, we need to think about newer approaches. There's chemo immunotherapy compared with targeted therapy approach as a randomized trial for early relapsers that is a US intergroup trial looking at the combination of bendamustine, obinutuzumab for those who had R-CHOP as their frontline regimen, or obinutuzumab CHOP for those who had bendamustine as their first-line chemo immunotherapy regimen. So that is one arm of the trial, or lenalidomide obinutuzumab as a second arm of the trial, or PI3 kinase inhibitor, umbralisib, and obinutuzumab as the third arm of the trial. And that really should be the preferred approach for this poor risk patient population. For those patients who are unable or unwilling to go on a clinical trial, the kinds of regimens that we might think about in the relapse setting as approved regimens are bendamustine, obinutuzumab, which this patient got in this particular situation, lenalidomide and rituximab, which now is approved based on the AUGMENT trial in the relapsed and refractory setting, or other forms of chemoimmunotherapy. For those patients who are young enough and healthy enough, autologous stem cell transplantation should be considered. After that, those typically would be patients under the age of 70 who are fit and well enough to undergo autologous stem cell transplantation. There also are clinical trials exploring CAR T cells in this setting for patients who are early relapsers. While this patient experienced an early relapse of follicular lymphoma, which again happens in about 20% of individuals, the majority of patients will experience a later relapse, something longer than 2 years after initial therapy. For those patients, there are numerous approaches which are available and options. Occasionally, single agent rituximab can be used in that setting to control disease and help to prevent a subsequent relapse. In addition, lenalidomide rituximab is now approved in that setting. Bendamustine obinutuzumab is another option that can be used in that setting. And any of the first-line chemoimmunotherapy regimens that weren't used in the first line also are potential agents to use in the second line with a relapse. For patients who experience a second relapse after that first early relapse, there are a number of other agents, including those that I just mentioned, that would be options. And additionally, the PI3 kinase inhibitors by themselves are approved in